Thoracic outlet syndrome injury prevention for firefighters, presented by Indiana State Doctorate of Athletic Training students. Firefighting is a physically demanding job. Between lifting heavy equipment, working overhead, and wearing gear for long periods of time, your body is under constant stress. One condition that can develop from these demands is called thoracic outlet syndrome, or TOS. TOS happens when nerves or blood vessels get compressed or pinched as they travel from your neck down into your arm. This compression occurs in a small space between your neck, collarbone, and shoulder called the thoracic outlet. When that space gets narrowed, it can get difficult. It can affect how your nerves and blood vessels function, leading to pain, numbness, weakness, or circulatory problems in the hand or arm. Firefighters are especially at risk for TOS because of the physical demands of the job, repetitive overhead tasks, carrying heavy equipment, and wearing SCBA gear can all place extra stress on the thoracic outlet. Other occupational factors that increase risk include prolonged upper limb loading and increased neck and shoulder muscle size, which can further reduce space in this already tight area. If left untreated, thoracic outlet syndrome can progress into chronic nerve or blood vessel dysfunction. Over time, this may lead to persistent pain, muscle weakness, circulation issues, or even permanent damage. That's why early recognition and intervention are critical to prevent irreversible deficits, vascular complications, and potential occupational disability. A primary prevention would be preventing symptoms before they even start. Because firefighting places such high physical demands on the body, prevention should start before symptoms ever appear. The goal of primary prevention is to reduce risk factors and improve movement quality. Some physical risk factors include repetitive neck or arm movements, excessive overhead arm positioning, shoulder girdle instability, tight or shortened muscles, altered joint mechanics, pregnancy, and obesity. Primary prevention strategies include SCBA and equipment fit education to minimize excessive shoulder depression and collarbone compression, overhead task training, technique training to reduce prolonged shoulder elevation and strain. Secondary prevention focuses on recognizing symptoms early and intervening quickly to prevent progression. Common signs and symptoms include arm or hand discoloration, tingling or pins and needles, swelling, numbness, muscle weakness, muscle atrophy, pain in the hand, arm, or shoulder. If these symptoms are identified early, treatment can be much more effective. Tertiary prevention focuses on reducing symptoms, restoring function, and preventing long-term disability. Rehabilitation programs can be integrated into daily routines that focus on the neck, chest, and shoulders. Key components of this rehab include strengthening and stretching exercises, improving scapular control during upper body movements, breathing techniques, and proper head, neck, and pelvic alignment during work tasks. Some examples that you can perform are cat-cow. Get into a position on your hands and knees and then squeeze your shoulder blades together and then pull them apart. Repeat this 10 times for 3 sets. Another exercise is banded no monies, or standing external rotation. Standing with your elbows at 90 degrees, bent tucked in at your side, pull a resistance band in an outward motion, keeping your palms facing upwards and squeezing your shoulder blades together. Repeat 3 sets of 10. Lay on your stomach on a flat surface and raise your arms straight up of your head to create an I. Repeat this motion, continuing to raise your hands above your head. The next angle, put your arms at a 45-degree angle above your head into a Y shape. Continue raising your arms in this Y motion. And lastly, move your arms out to the sides to create a T, and again, raise your arms up in this T motion. Repeat all motions 8 times for 3 sets. Next is banded serratus punches. Standing with a band attached to an anchor behind you, place your hands in the band and move your arms/shoulders forward. The rest of your body will stay still while only your shoulders are moving, and repeat this 12 times for 3 sets. The last exercise can be a banded high to low row. Half kneeling with the band attached at a high anchor point, pull the band in towards your body in a rowing motion and repeat 8 times for 3 sets. Thoracic outlet syndrome can have serious consequences if ignored. But with proper education, early recognition, and targeted prevention strategies, firefighters can protect their health and maintain long term performance on the job.